One, thank you for joining us here at the 1947 archive. Given the critical situation South Asia is facing right now with the COVID-19 crisis, we are adding new programming to our channel to answer your questions about the crisis. Today's topic is a very interesting topic. The topic is COVID-19 vaccines, pregnancy, lactating mothers, and menstruation. My name is Karina Bhasin, and I'm volunteering to bring you this episode. Joining me today is Dr. Pallab Gangopadhyay. Dr. Pallab Gangopadhyay is a renowned and well established, accomplished doctor in his field of gynecology and obstetrics with now more than 25 years of experience. Dr. Pallab has served as specialist registrar in gynecology in NHS hospital until 2009, and now he is practicing as independent senior consultant gynecologist and obstetrician in Woodland Hospital and Bellvue Clinic. His writings have been published in several journals, including BMJ. It's more than a pleasure to invite you and have you today, Dr. Pallab. Thank you for joining us. Taking hello. Thank you for taking our time from your busy schedule for answering our questions. I welcome you once again.
Okay, thank you.
Yes.
Thank you. Uh,
All right.
yeah,
Yes. So, Dr. Pallab, I'll be asking you a few questions for our audience
please.
regarding this vaccination and their effects on pregnant women, expecting mothers, lactating mothers, those who are breastfeeding, and also young girls, women who are continuing with their menstrual cycle. So we will start with a very simple and basic question. Why there is so much hesitancy in women who are pregnant or breastfeeding, lactating mothers with respect to the vaccination? Is there any history associated to it that India have been having vaccinations in past as well? So were there any vaccine or vaccination in past which were not given to expecting mothers or pregnant mothers? Because today the women have been stopped to have this vaccination by their family members as well. So why there is such kind of hesitancy? If you can just share something about it.
Yeah. No, Corina, I actually do not think that hesitancy is a bad thing because whenever something new we use, which is obviously you can appreciate that this is a new thing that this COVID-19 vaccination, we need to ensure that it is safe for the mother and for the coming generation, coming child. And because now international ethical body has prohibited any testing of any medicine, any new medicine or vaccine to the expecting or breastfeeding mother, so the test could not be done with them. We
Hmm.
could not give some of that because all the things we give, all the things we say is based on evidence. And
Hmm.
for evidence, you got to do some testing. You got to give
Hmm.
it some pregnant mother and say, okay, there is no problem with them, so we can give it. And also, it is not only giving them and no problem with them, because a pregnancy has a very long term effect in the cognitive things, the cognitive development of the child. So actually, until the child is grown up, you cannot really say that any new medicine or any new vaccine is completely safe for the mother. So
Hmm.
hesitancy is actually quite a normal thing
Hmm.
that has happened because we
Hmm.
could not test really, and there is very little evidence, very little data to say this is that.
Hmm. This is very
Is that
important thing
possible?
that
Yeah.
yes, yes. This is very important that hesitancy to have hesitancy should be taken in a positive manner, and people should not panic around. The institutions should not panic that the audience or the population is hesitant to get vaccine. The objective should be to make them feel safe with the vaccination. That's a very important point that you have made. Thank you, doctor.
And,
So,
and can I,
yes,
can I say something? After
yes.
this, what happened that people who kind of sister, the nurses, the other doctors who are in a very high risk situation, who work in a very high risk situation, like in the COVID ward or got to see COVID patient and
Hmm.
being pregnant. So they thought they will take this vaccine voluntarily
Hmm.
without
Hmm.
knowing the thing. Because
Hmm.
now the stage has come that you got to always, anything have got risk, anything have got benefit. So you got to weigh them up. So
Right.
in UK and even in America, people were said that if you want to, if you think that your risk of being infected with COVID is too much, you probably can take vaccination even when pregnant. So
Hmm.
that's how the first few vaccination during pregnancy happened. They
Hmm.
voluntarily taken the vaccine, knowing fully well that the result is not known. And
Hmm.
then we find out that there is nothing happened.
Hmm.
And you know,
Hmm.
like it should not be anything happening because influenza vaccine is regularly given in pregnancy. And
Hmm.
influenza is a
Hmm.
kind of like a cousin virus of this COVID-19. So it should not be causing really problem.
Hmm.
And now we have got data from the
Hmm.
exposure of the high risk mother. So
Hmm.
government have taken time to feel completely safe before going it, giving it to the mother before recommending, because government and the health authority got to recommend for the mother.
Hmm. Hmm.
You
Hmm.
understand this?
Right.
So
Right.
before recommending, they got a responsibility when they give the recommendation. So that is
Right.
why the delay is.
Hmm. Hmm. Absolutely. Very rightly you have shared that how this exposure and the testing has happened, because still people are feeling that the testing has not been done on the pregnant women, and therefore they do not want to experiment with themselves. They do not want their child, unexpected mother, to get experimented with it. So it's very important to share with the audience that the testing part, voluntarily few people have showed up themselves and get themselves vaccinated, and the
Yeah,
results are positive, and now the government is recommending as well.
yeah.
Yes. So my next question is, since getting vaccinated is still a personal choice, so in case if one does not get the vaccination, what kind of the severe illness, or the high risk of getting severe illness is with the pregnant and the lactating mothers if they contract the virus? What worst of the illness side we can see if one is not vaccinated?
Well, you understand during pregnancy what happened? Some physiological change happened. Body
Hmm.
changes within itself in any girl. One of the major changes that the diaphragm, which is main force for our taking breathing,
Hmm.
diaphragm cannot work very well because the uterus grows so large. Uterus
Hmm.
prevents the diaphragm for getting up and down. Very
Hmm.
easy. So,
Hmm.
if any pregnant woman get actually a lower respiratory tract inflammation or infection, it tend
Hmm.
to become very severe because the diaphragm do not work properly. So anyway, their volume of the air taking, their vital volume, we can say, okay. So that
Hmm.
become decreased. So they are in a high risk of having a respiratory failure much more quicker than the other. And
Hmm.
apart from that, there is other risks because of the thing that it is a bit of immunocompromised state, pregnancy, which is a good thing and a bad thing as well. Because it being a immunocompromised state, the cytokine storm, which is basically immune mediated and kills many, is
Hmm.
basically happening much less in the pregnant patient. In the
Hmm.
pregnant patient, the main problem is basically respiratory failure.
Hmm.
And Other thing is that most of the medicine given in the non-pregnant people, like like tosulism or whatever, but they are we do not know what are those medications effect on the child.
Hmm.
They are
Hmm.
pretty new medication. We do not know.
Hmm.
So, but however, if that comes like that, remdesivir got to be given in if the lady's condition is so bad, then we
Hmm.
would not think about the baby's thing. We would always try to make sure that the mother lives.
Hmm.
That
Hmm.
is what
Hmm.
will be the intention. And baby coming second in that case. However, the now steroid is very commonly being given, and steroid is probably okay after first trimester
Hmm.
uh,
Hmm. Hmm.
to be given. After first trimester, steroid do not cause much problem to the baby.
Hmm.
Not much.
And from this is my next question actually. Like, in which trimester should the expecting mother get herself vaccinated? And secondly, after what, like how many, what should be the time period after the delivery that one should get vaccinated, in case if one is going for vaccination? So one is while being pregnant, and in which month should I get vaccinated? And secondly, after the delivery, when can one go for vaccination?
Okay. There are three things here. First of all, if someone asks during pregnancy and ask me that when they get vaccinated, I probably, although the data is not available, clear data is not available, at the moment, my understanding of the thing says that anybody can get vaccinated after 12 weeks of pregnancy, because within the 12 to 14 weeks, baby's structure actually been formed, and there
Hmm.
is no risk of congenital anomaly remain. So after
Hmm.
12 weeks, after the screenings being done on the baby, they can easily take the vaccine, not a problem. However, if somebody have taken the vaccine and came to know that she was pregnant at that time, she was in a very early pregnancy that time,
Hmm.
she should continue that pregnancy. There is no indication of termination of pregnancy because of this vaccination. So
Hmm.
I have seen already two people came to me. They have taken vaccine, and after that they found they were pregnant, and the ultrasound shows they were actually pregnant even when they have taken the vaccination, and they were very anxious, both the parents, and say
Hmm.
whether
Hmm.
they go to terminate for this. And I
Hmm.
strictly says no, nothing to worry. And so
Hmm.
far, I have run few tests on those babies, and all the
Hmm.
result came as normal. So
Hmm.
even if accidentally vaccination, even before actually we used to say there is no indication of thinking about termination. But
Hmm. Hmm.
anyway, if there is a elective vaccination, I would advise them to take it after 12 weeks.
Hmm.
And
Hmm.
during breastfeeding, anytime they can take anytime. Probably what will happen that we will start to give vaccine after the delivery if they are not previously vaccinated. After
Hmm.
delivery, before they go to home, we will give them the vaccine. That is what I
This is
think is coming.
right. I'll repeat this thing for the audience. The only worry the doctors are saying with the vaccination of the pregnant women is the cognitive development of the fetus, of the child, and that cognitive development takes place after 12 to 14 weeks. So it's safe to take the vaccination if it is a planned vaccination, then it's safe to take within the time period of 12 to 14 weeks of pregnancy. And
But
secondly, for the
basically, we do not know. I'm not
who do not
concerned.
know,
The fact is
right,
that we do not know. That is why.
right, right.
Okay.
And
Hmm.
for the women who are breastfeeding or who have given recently given birth to a child, can immediately take the vaccination. There is no worry. about it. And in fact, before going home, also they can, from the hospital itself where they have delivered, they can take it from the doctor. Yes.
Yes,
So,
and that will be very good. I think that will be very good if those early delivered people given the vaccination, they
hmm,
will develop antibody in their body, the
hmm,
mothers, and some of
hmm,
those antibody will come out through the breast milk and
right,
automatically protect the children. Because still
right.
now the vaccination of the neonate is not recommended, as we know. So
Hmm,
basically, if the mother is vaccinated or during pregnancy or early puerperium, after just after giving birth, then the antibody through the breast milk will protect the child, and that is a big
hmm.
advantage actually having this vaccination.
Right, right. I think this is the most important thing that can motivate the mothers to go for the vaccination. That if they get vaccinated, the antibodies, the advantage of developing that antibodies through the breastfeeding will reach to their child, to the infant as well. So they are saving two lives at a time, in fact. So they should go for vaccination. Thank you, doctor. My very interesting question is: suppose if I get my vaccination, if one get vaccination before the pregnancy, the very first dose, then
Mhm.
the second dose, how to plan that second dose, and if that dose does not comes between that set time period which you mentioned, 12 to 14 weeks, should we delay it,
No,
that?
no, they should take it. They should take it.
Or they should take it. All
I
right,
think they
and
should take
all right. And how to manage the breastfeeding routine on the day of your vaccination? Do we need to make some changes to it? The mother need to make some changes?
No, not at all, not at all. Not at all. Vaccination is just an injection. You know,
Right.
probably even during the pregnancy, we do some vaccinations. We do
Hmm.
give them jab for tetanus, for diphtheria, for pertussis, and from influenza.
Hmm.
What prevalent
Hmm.
influenza is now given. So it is
Hmm.
just another vaccine. Okay,
Right.
because that's because it is new and something which is being in the press
Hmm.
so highly. You should not worry about it. It's just
Hmm.
normal day, just taking an injection, just taking a
Hmm.
jab. It's an
Right.
IM jab, nothing else than that.
Right.
And I think the pain from the jab will be much lessened if the mother care for the baby. If the baby is on mother's lap, then the mother's pain will be less because mother's mind will be engaged to the baby much. So I think that is the best possible thing, that mother continue to breastfeed and we give them the jab.
Right. This is very important for the caregivers, care providers to the mothers, that this is just another jab, as the doctor is saying. If you say it in a very fashionable statement thing, it's another jab. The women, the mothers already have been vaccinated, given vaccination at the hospital itself, multiple vaccination, and it's another vaccination that they will be getting.
Yes,
So need not to worry. In fact, support them mentally and calm them down, help them ease their anxiety, and go for
exactly.
it. Right,
Yeah,
right.
yeah.
So, doctor, what are the side effects? Have there been any side effects with the vaccination, with the pregnant or the breastfeeding with mothers? Have you
Well,
observed, like, yes.
yes, the question, the side effect question, wherever we go and say our things,
Hmm,
being a scientific doctor, we always face this question of side effect. Apparently,
hmm,
no other medicine have got side effect. But what we understand as side effect, that if you take something for your eye, obviously that will go to your leg as well and cause some effect
hmm,
may be there, and that effect is side effect. Matlab,
hmm,
where
hmm,
the actual work of action side of that, it might do some other action. That is
hmm,
that is side effect. Side effect is
hmm,
not some people And because we are the scientific medicine, we believe in scientific medicine, we carry out studies and know what could be or what could not. Now, obviously, for any vaccination, there might be a little fever, there might be a little pain in the site of the injection, and maybe for
Hmm.
1 or 2 days, it's a kind
Hmm.
of flu-like symptom.
Right.
However,
Right.
uh, if whatever happens, you should report to your doctor, and there is a reporting to the government portal. In the
Hmm.
COVID portal, there is a place for reporting of your side effects. In very, very rare cases, in some of the vaccine, some problem might be happening, but most of the problem, what we can see in the WhatsApp or in the other social medias, are completely fake, completely, what I should say, generated from the anxiety of the patient. If you just bring the needle to the patient and even do not give it, they cry, "Oh my God!" Why? Because they are so anxious. They feel the pain
Right.
even before they are given pain. The same thing is happening. They know there is a vaccine been given, so they will be. I get so many calls, not from really mothers, but from my friends and other people, that whether they can eat few food stuff, whether they can
Hmm.
drink few drinks, few special drinks.
Hmm.
Eh,
Hmm.
So
Hmm.
they think everything about the vaccination, whether they can eat something or not, whether they can drink something special or not. But these actually do not affect. You should be carrying on your just normal lifestyle.
Hmm. Hmm.
Obviously, so-called side effect, that is basically side effect mean your immune system is being charged up. So that is
Hmm.
not a bad at all.
Hmm.
That
Hmm.
having a bit of pain, feeling a flu-like bit of body ache for a day or something, a little a bit of high temperature, not a bad thing at all. It's a good thing. It proves that you are developing yourself within immunologically. So don't
Right.
worry about it at all. My message
Right.
is don't worry about that. And this number of side effects is so low. It
Hmm.
should be ignored. Like, do you do anything? You live on a high skyscraper. There is a risk that it might fall in a, any day it might fall. You
Hmm.
go cross the road.
Hmm.
There is a risk that you might get hit by a car. So,
Hmm.
in life, as soon as you are alive, you continue to do all the work which constitutes some risk.
Hmm. Hmm.
Without which you
Absolutely.
cannot do anything. So this is
Right.
something. So I would discourage people to think about any side effect of the pregnancy, any side
Hmm.
effect during this happen. However, if
Hmm.
anything serious happen, we are there. That person should come to us and tell whatever happening. We would, but that is a very negligible amount.
Hmm. 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 Hmm.
Okay,
So,
like people
right.
do not stop, like going on to car because of the risk of accident, do they? No. So
True.
still they travel through car. This is something like
True.
that.
True. So very three important points doctor has put across is a if you get vaccinated and have developed some side effect, so that means that your immune system has been charged up. The vaccination has started working on your body, so need not to worry. And in case if there are any severe side effects or you feel very restless about those side effects, so it's a request to reach out to the government portal and report your side effects over there. Also, CoWIN is the platform which the government has created, Indian government has created for people, for the normal people like us to report their concerns over there in case if you do not get access to any specific doctor nearby you. So that portal also helps you to address your queries. The other very important thing is we need not to panic. In side effects are just a normal thing like any other medicine. If we do get the side effects. So that's just a part of it. We lost Dr. Upadhyay for some for some seconds. Yes, he's back with us again. So yes, thank you, doctor, for clearing that doubt. And this also has helped me with answering the second question. Is suppose someone gets vaccinated and is a newly mother. When can she resume work and can she get back to normal? However, you stated that just lead your normal life. So
Yeah,
right. So getting vaccinated, being a newly mother, you can go back and restart your work and just be live a normal life as possible. Right.
yeah.
Right. My another question is this: so the couples who are expecting or planning a family, there's a hesitancy within them as well that the partners are not taking the jab, not taking their first dose because they are planning to have a family. Are there any concerns related to it as well?
Not at all. Not at all. As I said before, that even if they are getting the jab, when they are actually gone pregnant unknowingly, there will be
Hmm,
no indication of that. It is just out because we wanted to feel safe before recommending it to the mother. We recommended it late, not something
hmm,
sinister is lurking there.
hmm,
So
hmm,
I would advise, please get vaccinated. Don't worry about that at all. And anybody, and actually, I got a very interesting question from one of my patients, and their mother, and would-be mother, got one kind of vaccine, and would-be father got another kind of vaccine, and they were thinking whether they should be having pregnancy because of that. But yes, these nothing to get worried about all these things. This is just one of the immunogenic thing you everyday get after exposing to any antigen. So
hmm.
just keep on your normal life.
Right. This is a very interesting thing that you have shared. I think a question that I would have missed on. If one of the partner has received another kind of vaccine, for example,
Yes.
Covishield, and
Uh,
the male partner has received co-vaccine, so need not to worry. The results are same. They are just the vaccinations. You can plan your family absolutely feeling normal and safe. Yes.
and
Uh, Right. So we will move towards the menstrual women. So how's the vaccination for them? Do we have to plan the vaccination as per our menstrual cycle calendar? Is there anything like that?
no, not at all. Not at all. You take the vaccination when, as soon as possible, you can get it. You take
Hmm,
the jab and do not worry about your menstrual cycle. I appreciate what you said that there are some reports actually
hmm,
coming that some menstrual cycle is getting bit of disarrayed after
hmm,
getting the jab. That is correct.
hmm,
Some reports are there, but we think our thinking about that is that if some people become very anxious
hmm,
about anything, if some
hmm,
people got anxious, then their menstrual cycle will be bit of haywire because they are so anxious. It may be work pressure. I think you believe you girls know that when you are very anxious, when there is too much stress, your period get a bit of disturb. If it is normal, unless it is mediated by some medicine. So any stress, any anxiety can cause a bit of menstrual cycle irregularity, and that is what happening on some people who are so much anxious about taking vaccine and so much anxious about even getting the COVID infection. I have seen
hmm,
people are almost mortified of fear of getting COVID. And so those
hmm,
anxieties causing menstrual problem, no denial of that. But those are nothing to worry about. They are not. They will not cause any something to afraid of, something to worry of. And when the anxiety level will decrease, the period will come to its own level. And you can
right.
always go and see a doctor if that happens.
Right. Very important, and I think something that every girl have forgotten this point, that our periods do get missed. We do get an irregular cycle when we are highly stressed during our examination or job stress. There are multiple factors which are included in that irregularity of the menstrual cycle or heavy flow during the periods. There are multiple factors. Vaccination is just one another thing. So we need not to worry about it. Right. Thank you, Doctor. I think I'm done with my questions, and it has been a really helpful conversation. The audience would have been able to address their concerns. Thank you. Thank you, Doctor, for joining us today.
Okay.
So thank you, audience. Thank you, everyone who has been there with us today. We will be hosting episodes on numerous topics similarly related to the COVID several times a week at 9 a.m. Indian time. Kindly follow us on Facebook or subscribe to our YouTube channel to catch all the episodes, and do not hesitate, book your slot and get yourself vaccinated. Thank you. Thank you, Doctor, once
Thank you.
again.
Okay. Okay. One sir. Bye bye.
Bye.